A complicated and multifaceted disease, the diagnosis and treatment of multiple sclerosis requires a multidisciplinary approach. From neurologists to physical therapists, speech-language pathologists, and dietitians, professionals from all fields contribute to the care of patients with multiple sclerosis. Multiple sclerosis is a chronic, progressive, demyelinating, neurodegenerative disease. It primarily affects the central nervous system, including the optic nerves, brainstem, spinal cord, cerebellum, and white matter. The disease attacks the myelin, the fatty substance that coats and protects nerves and assists with nerve conduction velocity. This process, known as demyelination, causes loss of nerve signals and scarring, or sclerosis, over time. With these signals interrupted, patients can experience unpredictable symptoms such as numbness, tingling, mood changes, memory problems, pain, fatigue, blindness, and/or paralysis. What exactly causes this autoimmune response remains unknown. Each patient's experience of multiple sclerosis is different. For some, symptoms may be mild and short-term. For others, they may be severe and long-lasting. These are some common symptoms of multiple sclerosis: blurred or double vision and dizziness, red-green color distortion, pain and loss of vision because of swelling of the optic nerve, optic neuritis, loss of coordination, numbness, prickling or pins and needles, paresthesia, muscle weakness in the arms and legs, spasticity, muscle stiffness and spasms, fatigue, bladder and bowel problems. Around 50% of patients with multiple sclerosis show cognitive symptoms linked to the disease, including but not limited to issues with focus and concentration, attention span, short-term memory, poor judgment. There is no single, authoritative test by which a healthcare provider can diagnose multiple sclerosis. Instead, neurologists use careful observation, MRI, labs, and other clinical exams to rule out other potential diagnoses. A patient's symptoms must meet two core criteria to diagnose multiple sclerosis. They must have experienced at least 2 attacks of multiple sclerosis symptoms within a 1-month span, or have a multiple sclerosis symptom that gets worse for at least 24 hours. The patient must also demonstrate damage to myelin in more than one area of their central nervous system. Physical therapists, occupational therapists, and speech-language pathologists all play a key role in helping patients with multiple sclerosis manage their symptoms. For patients experiencing muscle weakness and spasticity, physical therapists can provide gait and assistive device training, as well as exercise prescription. Between 50% and 70% of patients with multiple sclerosis report a fall within the last 2 to 6 months. Physical therapists can also educate their patients on balance, safety, and fall prevention. Additionally, physical therapy can help strengthen weak muscles and may help alleviate pain, while a physical therapist's primary role involves helping patients manage their mobility and function. They also have the opportunity to equip the patient with the knowledge and tools needed to optimize their overall quality of life with multiple sclerosis.